Acceptance commitment therapy is a form of therapy that uses acceptance and mindfulness in combination with cognitive behavioral therapy to help clients develop new ways of thinking about their situations. The basic concepts of the treatment method are inspired by Buddhist philosophy. The Four Noble Truths in Buddhism state that in life there is suffering, that suffering comes from craving, that to overcome suffering we must overcome craving and avoidance, and that a path for overcoming craving and avoidance is the Eightfold Path. While understanding the Eightfold Path is beyond the scope of this video, the first three truths are not. In cognitive behavioral therapy, there is this idea that how we think about things changes how we feel about them, and that this, in turn, changes how we respond. Acceptance commitment therapy takes these concepts a step further and suggests that when people feel distress, they often feel that they need to change their external situation somehow in order to feel happy. Families who are struggling with CPS understand this better than most. Dealing with police, caseworkers, judges, foster families, ineffective lawyers, and the unfairness of their situation are all distressing issues. And in these cases, families can feel the powerful urge to want to change their external circumstances so that they can relieve some of the distress that they're feeling. Unfortunately, there's not a lot that families can do about many of the issues that they face when dealing with CPS. The result is that at a time when they need to feel strong and self-assured, families can feel weighed down by feelings of guilt, shame, anger, frustration, helplessness, and hopelessness, even in situations when they've done nothing wrong. It's in these moments that it is so important to turn inward. When you can't change your external situation, the only thing you have left is to be able to change your thoughts and your feelings about it, to focus on the things over which you do have control. As parents struggling with CPS, you can control whether you're following your case plan. You can control how you're feeling using techniques like mindful breathing, exercise, diet, and other forms of self-care. You can control your thoughts with cognitive behavioral therapy, identifying unhelpful thoughts and reframing them with more helpful ones. You can control who you reach out to for support, including friends and family who might be willing and able to foster your kids. Some things are obviously more difficult to accept than others. When parents see their children suffering in the foster care system, when they see CPS caseworkers and foster families actively trying to alienate them from their children, when they are forbidden from seeing their kids, when they reported issues and those reports go unheeded, it's hard to accept that and let go. There's a story about a religious teacher who taught that all life is illusion illustrates when his son died and he was asked why he cried, he said, "Some illusions are more real than others." Some of the issues that you're going to face are going to feel more distressing than others. Some of the things that will happen in your case will feel particularly unjust and unfair. It is okay to acknowledge that. It is okay to accept that. However, you can't do anything to change the situation. Focus your energy on the things that you can control. When you have your children back safely in your arms, then you can undo some of the damage that's been caused and help them heal.